think right now the best thing patients can do to kind of see if there's any specific targeted agent that would be best for them, aside from an individual trial basis, is probably molecular profiling. This can be done by a variety of companies, but what this is really looking at the DNA in the patient's cancer to see what makes that cancer tick. So the DNA in somebody's cancer will look different than the rest of their DNA, because that's how cancers become cancers. They acquire all these abnormalities and mutations that allow them to grow like they shouldn't. So by doing molecular profiling, we can kind of get a snapshot if there's any particular driver in that individual patient's cancer. So this is really moving towards personalized medicine, where cancer treatment's not a one-size-fits-all approach any longer. So I think that's something for patients to bring up with their providers, is the possibility of molecular profiling, and see if that would be an option for them. Now, about the molecular profiling, not everybody has a result that comes back and identifies, this is the pathway that we have to treat your cancer, but at least it's give us more information, and the more we can understand what makes each individual cancer tick, then the better we can treat that individual patient. One of the challenges with molecular profiling right now is cost, and that's always a debate of kind of the benefit versus the cost of something. In my experience, these tests are expensive. A lot of times these vendors that are performing the tests bill the patient's insurance. They get the money that they're able to get from the insurance, but I have not had patients that have been stuck with a large bill. So I know that is obvious concern for patients, but that hasn't been my experience that it's been financially restrictive on the patient of whether this is a reasonable option.